8.3% of adults in the United States have diabetes, which is roughly 25.8 million people. Over the past 4 years at Spectrum Health, we have put a lot of time and effort into changing the way diabetes is managed in the hospital system. We know that diabetes and blood sugar levels have direct impacts on how fast or how well we heal from illnesses or surgeries. And so it's our goal here at Spectrum to help patients heal faster from their heart surgery, heal faster from their hip surgeries or knee surgeries or their pneumonia by controlling their blood sugars while they're here. We know that if we control blood sugars during surgery times and during surgical recovery times, that the risk for wound infection decreases dramatically. One of the systems that we've designed is to identify those patients with diabetes and those who may not know that they have diabetes. So when patients are admitted, one of the routine blood tests that we do is to check blood glucose levels. And if insulin is required, that it will be dosed in a way that does not cause severe hypoglycemia or severe or hyperglycemia, that's severe low blood sugars or severe high blood sugars. The systems are set up so that their diabetes should be well controlled while they are here. And then they have access to a diabetes care team who can help to make sure that transition to the outpatient world is seamless and that they have the care that they need once they leave our hospital also. So we understand that very often when patients leave the hospital, that the treatment plan to appropriately manage their diabetes may be complicated, and it can be difficult for patients to try and do it on their own. So for patients who leave the hospital but need ongoing care, we have developed a clinic that we've designed to have one-stop shopping, so to speak, for all of the services that you need to take care of your diabetes. You have access to a diabetes physician, an endocrinologist, as well as diabetes educators and nutritionists, as well as ophthalmologists who are eye specialists, and foot and ankle specialists, all to help you treat your diabetes and prevent problems in the future. I have a detailed understanding of diabetes and its impact as a person who has diabetes themselves and the parent of a child with diabetes. I'm fortunate enough to understand diabetes not only as a physician, but as a patient and as a father, and it directly influences how we set up our care systems at Spectrum Health. And we understand that diabetes affects everyone. It even affects the family members of patients with diabetes. And we know that by treating diabetes well and providing patients with the resources to care for their diabetes once they leave here, that has a tremendous impact on our community as a whole.